Hi, Dr. Paul here. Another question I got is, when can I stop my antidepressants? There's a short answer and a long answer. It depends on the situation. If the person, let's say it's a simple, SSRI helps with, let's say someone's going through grief and they're really having a hard time getting past it. I put someone on a simple SSRI or SNRI, and they get better, and then maybe 6 to 12 months passed, and they've gotten past the grief, and you never get over it completely, but you move on and you learn to adapt to it. And then they sometimes taper off of it and they do fine. That can happen. I've seen that happen. And I do have patients who are able to stop things after a while. Maybe the system retrains, maybe they don't need it anymore. I've seen it happen. More often than not, though, it's better to keep them on. Now, especially when it takes a combination of an SNRI, Wellbutrin maybe, and maybe a mood stabilizer. So if it takes more medications for a person to get the goal, the truth is you probably should just stay on them long term. And a lot of people don't want to hear that, but it's reality. And again, the problem is if these medications are fixing these problems and everything's moving correctly, and you pull the rug out from under it, then all of a sudden everything goes the wrong way, then people are going to suffer needlessly. And another complaint I get on my social media from people is, I can't stop these damn medications, I had a person today who told me Effexor XR saved my life. And another one says, oh, SNRIs, they're terrible because you can't stop them. Well, the problem is, if medications are working and you yank it away and again, they go the wrong way, yeah, you're not going to do well. But the thing is, that's not addiction. And people say, oh, I must be addicted to it. I don't want to be It's not addiction. It's a chemical thing. And if you want to keep everything flowing correctly, you should keep taking them. So if you're taking something away and you crash, it means that you shouldn't be taking it away. And then if someone says, I don't care what you say, I want to get off of it. I have ways of getting people off of things like Effexor. The problem is, things like Effexor, it's an amazing medication, but it's very short acting. It only works for a day. So if you miss a day or two of it, you'll definitely feel it. I have a tricks of stopping it and getting on something else and smoothing off it easier. But the problem is, even if I go off of it in a week or two with the use of Prozac, which helps to get off of it, then you're left afterwards with still the mood like it was when you first started before you took them. You're still left with that. And so, and the more medications it takes to get there, the more likely it is that you should stay on them long term. And again, you got to remember, with this subject, it's a medical chemical problem. And people will think nothing about, well, maybe they will, but if someone takes a blood pressure medication, a heart medication, a diabetes, a thyroid, cholesterol, aspirin once a day, that's 5 or 6 things maybe right there. Or maybe with diabetes, someone's on 2 or 3 things just for that. And then you got some people on supplements, so they're on a bunch of things like here, and then they don't think. And when I ask them about, well, how long are you taking those for? Well, I never thought about it. Exactly. You didn't think about it. Why? Because, well, the doctor said to keep taking it. Well, why is this different? It's not, because it's all chemical, medical. It's different because there's no blood tests, there's no scan, there's nothing I can show on paper, which is why I draw these pictures with my patients when they're in the office, especially my new patients. I explain what my medications are doing, and then they can see visually, oh, okay, and that makes sense now, so sometimes you show it to them and they see it and it makes sense, but some people still, no matter what you say or do, and some people just go off of things, they suffer, and they're so stubborn, or they're so against going back on it. And I say, well, did you feel better on it? Well, yeah, but what? Well, but I don't want to keep taking it anymore. I'm better now. I don't understand. I've been on it for a year, and I'm so much better than I used to be. And even my circumstances are better now. So I don't think I should take them now because this is, well, I go, yeah, but well, even if your circumstances are better, what if the chemical part's not better? What if the genetic part isn't better? And that's why you need to take it. And that's not addiction. It's just the reality is it's treatment of a medical problem. So that's the thing, is if you don't take this seriously, like other medical problems, then you're gonna suffer needlessly. And so when someone has withdrawal effects from something, that's a good sign that they were probably on the right thing. Now, maybe it means that I'll switch to something a little bit longer acting so that they can, if they miss a day or two, they won't notice it as much. We can do that. There's ways that we can do this, but if it's just a matter of someone saying, I just got to remember to take my pill once a day. I'll do it when I get ready in the morning with my other stuff. Not a big deal. Exactly. It's not a big deal. Just take it, feel better, don't worry about it. So yeah, hopefully that clarifies it. It's a tough subject. It's a tough thing for people to hear because people say, I want to be free from meds. I want to detoxify my body. I don't want to be on all this crap. I don't want to be on this, so people have this negativity that, yeah, I'm feeling better, but for some reason they get in their head that they're bad to be on, or they go to another naturopathic doctor who says, no, we'll do it this way. And then, and not that other providers don't have answers. Some of the functional medical doctors, naturopathic doctors, sometimes they do give supplements that can help. Not in my opinion, not as good as what I give, but they can help. So there's other things to do besides what I do, but what I do, these medications are extremely effective, change people's lives, and you just have to get used to the fact that, look, I can't help what I have. I can choose to treat it or not treat it. Why not treat it and feel better and not worry about it? So, I had a patient I saw once, and she, over the years, she tried to go off of, I don't know how many times, just countless times, she tried to go off. And anyway, she came in the office and she was upset with me. She said, I'm angry that I can't go off of these. And I still say, why do you want to? Well, I just, my opinion is that I shouldn't need to be taking them. And I looked at her, I said, to tell the truth, your body does not care about your opinion. So she told me later, I left your office really pissed off at you because how dare you tell me what I do with my body. It's my choice what I do and all blah, 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 blah. So she said, I was driving home. I was at a stoplight. I was still fuming, look in the mirror at myself, and I started laughing. And she goes, and I started like, what are you doing? You see this guy for years. He seems to know what he's doing. Every time you're on them, you feel great. Every time you're off them, you feel terrible. Why don't you, so she went home, she called me back. She said, I apologize that how I was acting earlier. She said, I apologize. Because I understand what you're saying. Every time I go back on, I feel better. Every time I go off, I feel terrible. And she said, why don't we make a deal? Why don't you tell me when it's time for me to go off of them? And I told her, great. And the reality is I'll never tell her to go off of them. But ever since then, she's been fine. She's never brought it up. She's good to go for a while now, because she's gotten through the whole struggle of the going off and when can I do it. And she gotten to that point where it's realistically is like she shouldn't, because if she goes off of them, she's going to feel poorly. And why feel poorly when it's unnecessary? When you have the answers and you've already had the answers, what's the whole point? So anyway, hopefully that's a very important subject, because I get this question quite a lot.